everybody. This is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very embarrassing problem, that is bedwetting. Now bedwetting is very normal in babies. They pass urine every 2 hours. They have to wear diapers. After Huggies and other diapers have come, its life has become a lot easier for the parents. Before that, with cloth diapers, the whole bed used to be wet, and if the parents are also sleeping with the child, they wake up every few hours because they are drenched in urine. But by the time the child is around 2 years old, they start attaining some sort of bladder control, and usually by the age of 7, they do not wet the bed at night. Adults also do not usually wet the bed. Sometimes both children and adults sleep so soundly that they imagine they are in the toilet and they pass urine only to find themselves wet and cold and miserable. How does one attain bladder control? The bladder sends signals when it is full to the brain, and the brain processes the signal and indicates when the bladder has to be empty. As the person gets older, they wake up and empty the bladder. A hormone is released called vasopressin, and this hormone reduces the amount of urine formed at night and increases the amount of urine formed during the day, so that the number of times the person passes urine during the day is greater than the number of times that they pass in the night. Also, the bladder capacity increases as we grow older, so we are able to hold more urine. But in some families, genetically this does not happen. The bladders are small, vasopressin release is not proper, and they all pass urine in the bed. In some families, they don't even consider that it is strange that a 14 or 15-year-old is passing urine in the bed. When primary nocturnal aneurysis is said to occur when the child has never attained bladder control and has continued to pass urine in the bed till they are 15, 16 or 17 years old. Secondary aneurysis occurs when a person who was dry for 6 months or more suddenly loses bladder control. If this happens, then you have to do some tests to see if there's diabetes or some other disease, if there's a spina bifida where the vertebral column is not fused so that the nervous control of the bladder is affected, or there is some other disease. Sometimes this problem becomes so embarrassing that the parents and the child or the patient does not even inform the physician that they have a problem with bedwetting. It is considered a stigma, an embarrassing problem, and people try to hide the fact. Parents and families of bedwetters suffer a lot. They are not able to go for functions to their relatives' houses for fear of wetting the bed. They cannot go on holidays and tours because how can you stay in a hotel and wet the bed in the hotel? So they become very self-centered, and some of them become very shy and are affected psychologically. Sometimes some acute stress can cause a child who previously did not wet the bed to start doing this. The stress may be a changing the school, changing the location, changing the house, or changing the city. If bedwetting persists beyond the age of 7 years, or it occurs after a person has been dry for 6 months or more, investigations have to be done. The urine should be checked for infection, the blood for diabetes, and X-rays should be taken to make sure that the spine is alright. There are some simple ways to tackle bedwetting. One is not to drink any fluid after 6 o'clock in the evening. In many families, milk is given to the child at 10 o'clock or 9 o'clock in the night just before they go to sleep. And all this milk is passed out on the bed in the middle of the night. The second thing is to set an alarm for 1 o'clock or 2 o'clock or whenever the bedwetting occurs, so that the parent and the child wake up and go to the bathroom. If you are an adult and you have some sort of disease which is causing you to wet the bed, remember that adult diapers are also available nowadays and you can use them and be happy. Everybody stay fit, stay healthy, stay happy. If you liked the content of this channel, please subscribe to my Health Vibes channel and press the bell button. The same content is available in Tamil. Thank you.